So at ESMO Breast this year, we present a poster on the ELEANOR study, which is a study in the German-speaking countries looking at the use of Neratinib in the indicated setting, which is in Europe hormone receptor positive, high-risk HER2-positive breast cancer within 1 year of trastuzumab-based therapy. So ELEANOR is just collecting informations on outcome of these patients with regard to how long they can stay on trial, and that's actually the primary endpoint is looking at the adherence to the treatment. We're supporting patients with an eHealth-based application called CANKADO, where they use it as a diary, but also can add their patient-reported outcomes, as well as it gives them sort of management while they're on therapy, which is supposed to relieve centers from seeing the patients so often. So very interesting project as well. And what we saw in ELEANOR was that actually in the German-speaking countries, the uptake of Neratinib was very fast. The recruitment is going very well. We now, even beyond this poster, have over 200 patients in the trial, and that the perceived risk of a patient and a physician is different from what we in the guidelines say is the highest risk. So we have about a third of the patients where we say, well, they actually don't have such a high remaining risk, and they still opted for participation, but about 2/3 of the patients do have a clinically high risk. And with the proactive management, like the dose escalation of Neratinib in the starting month, but as well also the loperamide prophylaxis, we're able to turn the very high diarrhea rate in the extended trial to about not the third, but at least less than a half, with a rate of about 15%. And I'm confident, because the dose escalations data hasn't been out there, that with really going with every patient with dose escalation and loperamide prophylaxis, we may even get the grade 3 diarrhea rate down even more. So very interesting data showing that the patients actually opt for Neratinib, and the main reason, that's also an interesting finding on the poster, of why they do it is because they believe the efficacy data is great. So they want to protect themselves further, and we learn that with proactive management we can sort of make the diarrhea side effect not to become one of these big problems.